When does the anxiety or depression a woman experiences during pregnancy or after the birth of a child need professional attention, and what should they look like? An expert in perinatal and postpartum mental health joins me to answer those questions and more next on Speak Your Mind. Welcome to Speak Your Mind. I'm Dr. Carolyn Phelps, licensed psychologist with the Human Development Center. Becoming a parent, or becoming a parent again if you have more than one child, can bring great joy and fulfillment in life, but it can also be a stressful time for mothers with nights of sleep deprivation and anxiety about things like newfound responsibilities or adding even more responsibilities to what already is on your plate. Tonight, we're joined by an expert guest to discuss the treatment of mental health issues in pregnant women and new mothers. And as always, your calls and questions are welcome as we explore this week's topic. So call the numbers on your screen right now. Locally, dial 218-788-2844 or call toll-free at 1-877-307-8762. And you can also email them using the address listed at the bottom of your screen. We'll be answering your questions tonight throughout the show. My guest tonight is the very special Dr. La Russo, who herself specializes in the perinatal and postpartum identification and treatment of psychiatric issues at Illini Health and Children's Hospitals and Clinics of Minnesota. That is a long name for the place where you work. Thank you so much for coming here. And I think, you know, most people are familiar with the concept of postpartum depression, or at least have heard that term. But really, we know that there's more than just depression that women can experience after childbirth and even during pregnancy. So talk a little bit first about the scope of mental health issues that some women face.
Well, postpartum depression is the thing that's gotten the most attention nationwide, and certainly it deserves a lot of attention because it's an important health problem. But if you think about it, any of the mental health issues that anyone experiences at any point in their life, one could experience during pregnancy or postpartum. So anxiety spectrum disorders, psychotic spectrum disorders, difficulties with eating disorders or chemical dependence, bipolar disorder. So for women, reproductive years are a particularly vulnerable time for the emergence of psychiatric illness, whether it be depression or anxiety. So pregnant and postpartum women are particularly vulnerable.
Because we know that these disorders are most likely to emerge during those young to middle adult years. And so and during those years you have such great life transition as well. So you have the combination of pregnant or not pregnant, this is your most at-risk time. Now you're going through often a lot of life changes as well. So we shouldn't really be all that surprised that during pregnancy, some women are experiencing mental health problems then.
No, it's not surprising, but historically the thought was that pregnancy was somehow protective from psychiatric illness. So, and I think that in the psychiatric literature, we know that's not the case. And certainly the postpartum time is a time of particular vulnerability for women. I think, though, the message that many women are getting culturally and through a lot of the advertising in ways that the pregnancy and birth and motherhood experience is kind of marketed is that it should still be a time of bliss and emotional stability. And really that's not the case for many women.
And not, I think on top of that, of sort of this marketing towards women that this should be the happiest time in your life. And I find that they don't just even market it as the happiest time of your life, but almost carefree time, which to me is just dumbfounding if you think about the changes in terms of during pregnancy, the changes that they're about to go through, and the major life change that means once they've given birth to a child.
Right, well, exactly. I mean, I think even people who don't have anxiety disorders are going to experience some anxiety during pregnancy. And that's very normal. It's an anxiety-provoking experience. And I think of it often as kind of a practice for being a parent. When you are pregnant, there are many things that you are no longer in control of the way that at least you thought you were before. So learning to let go of some of that control and being okay with some of that, to me, seems like you have 9 months to practice, because once you have children, that's a lot of what one needs to learn.
And so that's a very nice way of putting that, the not feeling like you're not being in control of your own body is a practice for kind of not being in control of your own life once the child comes along then.
I think that's certainly the way I frame it, because I think it's helpful to be thinking of a positive frame for a lot of the things that really do cause people a lot of anxiety when they can't
Well, and really
them.
that's about moving towards acceptance of that too, rather
Right.
than fighting that.
Right.
I think the other thing that I feel like we have in this day and age is a real focus on not just to be a good mother, but to be the perfect mother. And in fact, a staff member of mine told me before I came here tonight, she said, I think I saw this book on Amazon called Being the Perfect Mother. And I thought, oh, that kind of just made me cringe.
Yeah.
That notion of being the perfect mother. And with this list of do's and don'ts during pregnancy, let's talk a little bit about, I think before we sort of get into all of those do's and don'ts and what that means in terms of treating psychiatric illness, if we take something like anxiety, how does anxiety during pregnancy look compared to anxiety not during pregnancy?
Well, anxiety has been less well studied than depression during and after pregnancy. And really in the way that mental health professionals classify illness, there aren't separate disorders that are typical during pregnancy. But really, pregnancy is a time when many anxiety disorders get worse. That is true for many women. Postpartum is a particularly difficult time for women with anxiety disorders. So the symptoms can be very similar to anxiety disorder, to other non-pregnant anxiety, but often women have more worries that are focused on their experience. So either more worries about misinterpreting physical symptoms of their body and believing that they're negative when in fact they're normal, or lots of worries about are they doing things correctly? Lots of worries about if they're going to be a good parent, and then certainly once they have a baby, a lot of worries about the safety of their baby and if their baby's doing okay and if they're doing what they should as a mother.
Responding to the baby in the way that they should as well.
Yeah, I think that there are sort of different levels of worries, certainly, and it depends on the person and the disorder. But really, especially in the initial weeks, there can be a lot of worry focused on just the safety of the baby. And yes, am I caring for this baby correctly? Am I doing the right things? And are they healthy? Or is there something wrong or something bad that's going to happen?
And so we know that that women who have had mental health problems prior to becoming pregnant are more at risk to then experiencing mental health problems during their pregnancy and then after childbirth as well. With depression, people don't always feel depressed or sad per se during their pregnancy when that's related to a mental illness. They feel often more angry and irritable. Can you talk a little bit about that?
I think that's very true. I mean, it can be a bit more difficult to diagnose depression during pregnancy because several of the symptoms, changes in appetite, changes in sleep pattern, changes in energy level, are also normal symptoms of pregnancy. So oftentimes women who are experiencing depressive illness when they're pregnant will really notice a lot of irritability. We'll be able to say, wow, I am snapping, I'm flying off the handle at things that I know wouldn't have bothered me before, and it's a real problem. Or they'll notice more symptoms such as guilt, or ruminating on things that they wish they had done differently, or hopelessness about the future. So those category of symptoms can really be suggestive that someone might be experiencing an episode of depression.
And does that change then postpartum? Does that look more like traditional depression postpartum where you get that profound sadness that might go along with that?
Well, I think that depends. I think that's very variable. A lot in the classification of postpartum depression, it's not classified or described differently than other types of depression. Certainly, postpartum, many women might experience a lot of up and down mood, so emotional ability, or a lot of tearfulness, or if not profound feelings of sadness, feelings of, wow, this isn't what I expected and I'm not enjoying this. And lots of women talk about a feeling of losing time. This is supposed to be time they're enjoying and they're not.
And to me, that would almost feed on itself. Here you are, you're feeling depressed to begin with.
Right.
Now you're looking at yourself and watching what you're not doing the way you're supposed to be doing. So you've got this positive feedback loop that's
Right.
driving the depression even more. Good luck getting out of that without any kind of professional help then.
Right. I mean, I think there's a lot of negative self-appraisals and judgments. And, you know, I think even though we don't classify in the DSM, in the manual that we use to organize illness as mental health professionals, even though we don't classify postpartum depression differently than other types of depression, if you listen to women talk about their postpartum depression, there's so much meaning for them in what it means to be a mother, what it means to have what they were expecting to be joyful taken away from them, that there really is a way in which I think it can be, make women even more vulnerable to feelings of inadequacy at this time.
Here's a question from a woman in Duluth who calls in and asks, if a woman has postpartum depression with her first child, is it likely that she will with future children?
Having a previous episode of postpartum depression is a big risk factor for having another episode. So in women who've had an episode before, what you would want to do is make sure that they got connected to good treatment early on in their pregnancy, or certainly even when they were planning, you know, ideally when they were planning to become pregnant again. And then with hindsight, knowing what you know, you can put the things in place to help prevent that from happening again. So the risk is higher, but with that experience to guide you, you could certainly prevent it much more effectively.
And do we see that with anxiety or bipolar illness as well? That same trend of if you had problems with this in your first pregnancy, you're more at risk to have problems in future pregnancies.
I think it's, you know, there's not as robust data on those two conditions, but I think it's pretty safe to say that you can anticipate that you'll have a higher likelihood. And certainly for women with bipolar spectrum illness, whether or not you've had an episode postpartum with a prior pregnancy, postpartum time in general is a time of very high risk for emergence of symptoms.
So now let's talk about the treatment of mental illness and mental health problems in women who are pregnant and women after childbirth. So when we're talking about, first of all, when do you know that I need professional help? So let's talk about that first, maybe in pregnancy. When are you having sort of the normal, when do we transition from the normal anxiety, the normal maybe irritability that might go along with some hormonal variations and just the anticipating changes in your life, to I think I need some professional help?
Well, I think, you know, the answer varies depending on the woman and her comfort level with different symptoms. But I think a good thing to look at is, you know, it is normal to have apprehension, it's normal to have sadness, it's normal to have a range of feelings. But if you're having several weeks in a row of persistently low mood, of associated feelings of hopelessness or helplessness, not enjoying your life, and if you're struggling to function, I mean, some people, when they're depressed, their function drops off very quickly. They're not as easily able to fulfill their obligations, whether at work or at home. Other people are able to keep going pretty well with their function, but it's a major effort and it takes a lot out of them. So I would say if you're noticing your functioning decreasing, or you're noticing things persist for a couple to a few weeks at a time, you should certainly start by talking to your obstetric provider about what you're experiencing.
And certainly if you're feeling suicidal,
absolutely.
Then you know, don't stop.
Yeah.
Go right to your doctor. get some help. Let's talk about what help is going to look like, though, because now we get to the point where if a person who wasn't pregnant was having some really significant problems with depression, we might suggest that they go on some medication, on an antidepressant medication. And so now here is the woman. What do we do now? Because this is where we come to the, no alcohol, no drugs, no caffeine, no nothing anymore in order to deliver a healthy baby. And what is the best practice out there?
Well, I think the first thing is to remember that you have to approach things from a common sense framework. So what is going to be helpful to maintain the emotional stability of the mother and to help her get well is going to be the thing that's going to be the healthiest for her developing baby and for her and for the family. So I think you also have to start just from that framework of women deserve to get well, and that ripple effect will translate through the rest of their family. Secondly, the risks of untreated maternal depression to a developing fetus are very often overlooked. As the concern shifts quickly to what are the potential risks of the medication. So you have to balance the risks of untreated maternal illness, which are significant, to the potential risks of the medication. And then a rule of thumb is that for women with mild to moderate illness who are still functioning reasonably well, it would be optimal to start with psychotherapy. And if that weren't adequate to treat the symptoms, then you would look at adding on a medication. For women with more severe illness, moderate to severe, they're likely going to need a combination of medication and psychotherapy to get well.
And here is a woman who in fact said that her OB wanted to put her on an antidepressant medication. Is it safe? And so what is the scoop on is that safe?
Yeah, that's always the question, and there's a much longer answer to that question. I think the way I look at it is that the safest thing is the approach that gets the mother well. So, but in the spirit of the way the caller is asking the question, we have a lot of data about the SSRI, the selective serotonin reuptake inhibitor antidepressants, which are like Prozac and Zoloft. We have an enormous amount of data. The overwhelming majority is reassuring. And for women whose healthcare providers are assessing them to be in a position to benefit from a medication, who also think that their symptoms could benefit from that treatment, then there are some associated risks, but treating the maternal depression is absolutely the safest approach.
And I like what you said too, when you said like, wow, that's really a longer answer than what I'm going to be able to answer. But part of what makes it a longer answer is that it depends on each woman is going to be different. First of all, in terms of what is her history of depression before pregnancy? Was she on medication before pregnancy? How bad did that depression get compared to what this depression is, as well as what you mentioned, which is her own comfort level and where does she want to start in the getting better process. And so considering that is a much more robust conversation to have. And the other thing I liked about that is the notion that different women are going to make different decisions with that, and that's okay.
Yeah. I mean, mostly that's okay. It's not okay when someone is significantly ill and not accepting treatment, but generally that's not the case. I mean, pregnancy is a time when eliciting women's individual preferences is so important in helping to guide the treatment, and that women fall in a couple of camps. One, that very severe illness or a history of very severe illness, and they really have no desire to get off their medications because they know how bad things will get when they get off them. So the answer is quite clear in those cases, and there are things that can be done to minimize risk with certain medications. Then women who really the symptoms are not that severe and really feel much more comfortable starting with a non-medication approach, and that's actually absolutely the right place to start. There's a lot of gray where there isn't a clear, you really should do one thing or the other, but both options are are reasonable to consider, and that's where you really rely on what feels most comfortable to the patient.
Talk about the role of sleep deprivation in mental health problems postpartum.
Yeah, I mean, that's huge. That's sort of the number one destabilizing factor for women who are at risk of having illness postpartum. You know, I tell patients, look, sleep deprivation is a torture method, and there's a reason why, because it makes people crazy and it's intolerable, really. Sleeping is the most fundamental human need. So for women who have psychiatric illness, they cannot necessarily tolerate the same amount of sleep disruption that someone who doesn't have that set of illness can. So we work very hard to work on ways to change breastfeeding routines or get support overnight so women can get some consolidated sleep and then still be available to help with their children.
And here's a question that comes in from a man in Duluth saying, what are the safe medications for a depressed woman, not just while pregnant, but also while nursing? And so there again, we sort of get to that question of you know, is it safe for the baby now while I'm nursing, number one, and what does the role, how does nursing even affect sleep deprivation, affect mental illness?
Right. Well, the nursing question is another. None of these questions are quick to answer. I mean, again, back to the safest. You know, the thing that the short answer is that all medications are transmitted in breast milk, but generally at lower concentrations than they are when the baby is in utero. So overwhelmingly, the SSRI antidepressants are compatible with breastfeeding. And indeed, almost all our psychiatric medications are compatible with breastfeeding and cause minimal adverse effects in breastfed babies. There's a lot of advantages to breastfeeding, and women who are told that they have to stop their medication to breastfeed are most of the time being given incorrect information. What they're not being told is that they may need to change how frequently they breastfeed overnight in service of getting more sleep, because that will help them stay well or get better if they've become ill.
And so that brings to mind sort of the role of the partner in this. If a woman is having children and she has a partner, she's lucky enough to have a partner, talk a little bit just about how partners can help women who may be struggling with some anxiety or depression after childbirth.
Well, I think partners can play a huge role. I mean, one, helping to, a lot of partners pick up on the mother having an issue before the woman herself recognizes or is ready to acknowledge that they're struggling. So I think being attentive and being attuned and talking with your wife about what she's experiencing and what your concerns are. I think being non-judgmental and understanding that there's a big learning curve is very helpful. And then I think just practically being involved, doing things like saying, I think you should go to bed now and try to sleep for 4 hours. I'll watch the baby and I'll get you up at X time and you can do that feeding. And certainly if there are any concerns, I think going with your partner to their doctor visit and talking with having a conversation all together is important.
I think that's a great idea, that notion of being a partner every step of the way, going to all the visits, both during pregnancy but after pregnancy, or after childbirth rather, as well, and being the person who's willing to get up in the middle of the night to do some of those feedings. We are just about out of time. What are the short parting words that you would like to leave for our viewing audience?
Oh boy. Well, I think that I think the more that people can have a common sense approach and can really think about the interventions that will optimally support the emotional health of the mother and being willing to consider a range of different things to help, knowing that when the mother is optimally supported, that's the best start that her child can have in life.
I think that's a great closing message to have, that you just cannot consider the baby all alone, because it's a together relationship. You have to consider both the mother and the child dyad and what's best for both of them. Thanks so much for joining the discussion this week, and don't forget to visit us on the web at speakyourmindonline.org, where you can find a schedule of our topics and resource links, and read my blog, the place where I answer more of your questions. You can also email us your questions about next week's show, when we'll be talking about anxiety and anxiety disorders. I'm Dr. Carolyn Phelps. Thanks for watching, and good night.